In this video, we will review everything what you have to know about hemoglobin structure, function, and clinical significance for examinations. So let's dive in. Hemoglobin is a protein in red blood cells that's critical for gas exchange in the body. Its primary job is to carry oxygen from the lungs to tissues and to transport carbon dioxide back to the lungs for exhalation. Hemoglobin is composed of two major substrates. It's heme and globin. In turn, heme is composed of iron and protoporphyrin. Any factor that disrupts the production of hemoglobin leads to microcytic anemia. And we know that microcytic anemia has two major diagnostic features. It's decrease in hemoglobin with simultaneous decrease in MCV. And there are four pathologies that disrupt hemoglobin production. It's iron deficiency anemia and anemia of chronic disease. Both of them cause decrease in iron which is available for heme production. It's sideroblastic anemia which affects the synthesis of protoporphyrin, and it's thalassemia which affects alpha and beta globin chains. Hemoglobin is a tetramer, meaning it has 4 subunits. Normal adult hemoglobin is composed of 2 alpha and 2 beta chains. So here we have simplified hemoglobin structure. There are 2 alpha and 2 beta chains. Each chain has iron with +2 charge. Each iron with +2 charge can bind 1 oxygen molecule, so in total hemoglobin can bind up to 4 oxygen molecules. If hemoglobin has just 1 oxygen molecule, we say that hemoglobin saturation is 25%. If hemoglobin carries 2 oxygen molecules, its oxygen saturation becomes 50%. 3 oxygen molecules give saturation 75%. And if hemoglobin has 4 oxygen molecules, it's 100% saturated hemoglobin. So any hemoglobin molecule has 4 subunits, but these subunits can be different. Alpha subunits are the same in any hemoglobin molecule, but some hemoglobin molecules do not have beta subunits. For example, even in normal condition, we have a small fraction of hemoglobin A2, which is composed of 2 alpha and 2 delta chains. This fraction of hemoglobin increases in beta thalassemia. Also, we have fetal hemoglobin, which is composed of 2 alpha and 2 gamma chains. These gamma chains give fetal hemoglobin a high oxygen affinity, which helps fetus to bind oxygen from maternal blood. The normal level of hemoglobin for males is 130 to 160, for females 120 to 140. Any decrease in hemoglobin level we call anemia, and hemoglobin level above normal we call polycythemia. The most important concept about hemoglobin for examinations is that hemoglobin is allosteric protein. It has positive cooperativity in relation to oxygen. So let's explain this in more details. First of all, what is it allosteric proteins? An allosteric protein is one whose function or shape changes when a molecule, like oxygen, binds to it. This change affects how it interacts with additional molecules. Hemoglobin exhibits allosteric behavior when hemoglobin binds oxygen. This means that the binding of 1 oxygen molecule to 1 subunit enhances the binding of oxygen to the other subunits. So, because hemoglobin is allosteric protein, if 1 oxygen molecule binds to hemoglobin, it causes a conformational change in the hemoglobin molecule. This change makes it easier for the remaining subunits to bind additional oxygen molecules. In smart words, hemoglobin affinity to other oxygen molecules increases, and because the binding of oxygen molecule enhances further oxygen binding, we call this phenomenon a positive cooperativity. We have to know that the only thing that can force hemoglobin to give away oxygen is decrease in partial pressure of oxygen. Partial pressure of oxygen is basically the concentration of oxygen. The lower the partial pressure of oxygen, the more rapid is oxygen dissociation from hemoglobin. For example, with partial pressure of oxygen 100, the dissociation is 0. Hemoglobin gives away the first oxygen molecule only when partial pressure of oxygen becomes lower than 40. The dissociation of two oxygen molecules occurs only with partial pressure of oxygen lower than 26, and four oxygen molecules dissociate only with partial pressure of oxygen near 0. To explain the significance of positive cooperativity, we have to understand oxygen dissociation curve. So here is partial pressure of oxygen, and here is oxygen saturation. Without positive cooperativity, partial pressure of oxygen and oxygen saturation have linear relation. And this purple curve is how oxygen dissociation occurs in real life due to the positive cooperativity. In oxygen saturation, we are interested only in points where hemoglobin gives away oxygen molecules. So it's a point when hemoglobin loses two oxygen molecules and becomes 50% saturated, a point when hemoglobin loses first oxygen molecule and becomes 75% saturated, and loss of three oxygen molecules make hemoglobin 25% saturated. We have to know that our tissues have partial pressure of oxygen between 20 and 40. So this red area is where hemoglobin should drop oxygen molecules. And it's vitally important for hemoglobin to drop oxygen precisely into this area and not earlier, because otherwise tissues will not receive oxygen. So let's take the moment when hemoglobin will give away the first oxygen molecule. So it's the moment when hemoglobin will become 75% saturated. As we see, without positive cooperativity, if the relation is linear, hemoglobin will drop oxygen into the blood and not in the tissue area. Instead, with positive cooperativity, we deliver oxygen precisely to the tissue area, and there is a very simple reason. When hemoglobin is fully packed with oxygen, because positive cooperativity enhances hemoglobin affinity for oxygen, it takes a more negative partial pressure of oxygen to force hemoglobin to give away oxygen molecule. So the first conclusion is that positive cooperativity increases the distance of oxygen transportation. Basically, it do not let hemoglobin to lose oxygen prematurely into the blood. With 50% saturation, the same thing. Without positive cooperativity, hemoglobin will drop oxygen into the blood and not in the tissue area. But with positive cooperativity, second oxygen molecule will be delivered precisely into the tissue area. And only in 25% saturation, hemoglobin without positive cooperativity will deliver oxygen molecule to the tissues. But even in this case, positive cooperativity will let hemoglobin to deliver third oxygen molecule to the tissues. So, with positive cooperativity, we deliver 3 oxygen molecules to the tissues, and without only 1 oxygen molecule. So, it greatly increases the effectiveness of oxygen transportation. So, as we see, due to the positive cooperativity, hemoglobin that carries oxygen has 300 times higher affinity for oxygen than deoxygenated hemoglobin. And in turn, hemoglobin without oxygen has lower affinity for oxygen and high affinity for carbon dioxide. Also, hemoglobin can to some extent regulate pH, we call it a buffer function. Hemoglobin without oxygen can bind a few hydrogen ions, thereby neutralizing them. And the lower the concentration of hydrogen ions, the higher becomes the pH. So it can to some extent neutralize the acidity of the environment, which is important in case of acidosis. Also, we have to know that we have glycated hemoglobin. Glycated hemoglobin we widely use to monitor average blood glucose level over the last 2 to 3 months. If glycated hemoglobin below 5.7, everything is fine. But if it's above 5.7, then we should suspect diabetes. And some people have hemoglobin S, which is a characteristic hemoglobin for the people with sickle cell disease. Also, we have to know that myoglobin, which is a specific protein that binds oxygen in our muscles, is a very similar molecule to hemoglobin in terms of function. But the difference is that myoglobin is composed of a single polypeptide, so it's not a tetramer, and myoglobin has significantly higher affinity for oxygen than hemoglobin.